Okay, here's a quick video that I'm going to show you about hamstring stretching, specifically for lower back pain. And I'm going to show two people who have almost identical symptoms of lower back pain. So it's in the same area and it feels the same. It hurts all when they do this and that. And, it's commonly what we see a lot of the time. Most people think that hamstrings are a big problem, and they often are. However, in some cases, it's the fact that hamstrings are not tight enough that is the main problem. So here's how to know for sure whether you need to stretch them or not, and I'll show the two people and why it looks so different, why one should stretch and why one should not. All right, so let's have a look at it.
Okay, so we're going to run through a couple of tests. Now I'm going to start with hamstring and sciatic nerve test here. This one's always a giveaway with the flexion-related person, who we're starting with, which is Mel. Just because the pelvis is being pulled under, those hamstrings are usually very, very chronically tight, and their butt muscles, their glutes, almost pretty much non-existent. That's why they've got that flat sort of appearance. These hamstrings are creating lots of problems with the back, and this is setting them up for that disc bulge problem. Right, so we want to sort of assess what her flexibility or range of motion is like with the sciatic stretch. So basically I'm going to take her leg and I can sort of feel like, all right, that's a fair bit of tension there. That's a lot of tension because it really should be at 90 degrees, all right, which would be somewhere here. So that's a positive test telling me I need to have a stretch to correct this. All right, now that'd be just for the nerve. With the straight leg like that, we're testing her nerve. All right. Sometimes it's not actually the hamstring, it could be just the fact her back is so tight. All right, but in this case, that's definitely a hamstring. Then we're going to bend the knee and we're going to see what this is like, and that's pretty tight there because we should be able to get more range out of that. All right, so that's a positive test, meaning that if she fails that, now we need a stretch to correct it. All right, and it's now confirming our suspicions, which helps us with the exercises that complement the stretch. So now I'm going to bring Dylan into the video and we're going to look at the exact opposite. All right, remembering that Dylan has the pain in the same area, but we've identified his as a completely different posture. We'll assess his hamstring and we'll most likely find that he'll have optimal flexibility. So see that? No problem, straight to 90 degrees. Where Mel was somewhere here, right? No good. He's got exactly where he needs to be. Probably, if anything, he's probably got too much and that he needs to probably tighten up through there. This means that we don't want him to stretch that area. If he stretches that area, he'll make himself worse. All right.
Okay, so recapping on what I just covered, you must test to determine if you need the stretch. If you can achieve 90 degrees with a straight leg, you do not need to stretch the hamstring. So you can see Ellie here has got a perfectly 90-degree angle, and that's exactly where it needs to be. So in that case, she doesn't need to do the stretch. She's just demonstrating how you do that on their own. She's got like a rubber band, but you could easily use a towel. Now the straight leg stretch is more of a sciatic nerve stretch, and where you should feel that is tension behind the knee because the joint's being sort of locked out. If you feel pain in your calf, your neck, your lower back, anywhere other than behind the knee, that's sort of an indication that the sciatic nerve is being trapped. So do not stretch a tight sciatic nerve because it's already under too much tension anyway. It's getting pinched from somewhere and it's getting really overly taut from the rest of it because it's not flowing through where it should flow. So that's where nerve flossing is more useful, and there's a good video that we have on that. If I should have put a link in the description of this video, you can find that to watch that. That's a much more useful way of doing it. You'll probably often find it's a problem through the hips that are creating that in the first place. Bent leg stretches are always the most effective for the hamstring muscles themselves. So if you're a person with a flat back posture, or if you're commonly tearing hamstrings, it's always a sign that they're too tight in the muscles. And you're a person with a disc bulge is always it's always an area that I commonly look for. Not always, but probably 90% of the time is hamstrings are a little bit too tight. PNF or contract relax stretching is the most effective way of loosening them up, as is daily stretching and at night. So if you can do that, and there's plenty of articles we have on the reasons for all of that, and you can go into that. And again, in our back pain secrets video series that comes with the ebook, there's this and all of the other stuff that applies to what you're looking for. So in terms of how to stretch the hips out, thoracic spine, all of the stability exercises to ensure that that it's you're stabilizing yourself, and then how to move and strengthen. All of that is covered in that series. So if you're someone with chronic back pain, I highly encourage you to get it. It's got everything you need. It's a 90-minute video, this one, by the way. So it'll give you all the stuff that I've left out of this one, which I'm just looking at hamstrings. But anyway, if you had a hamstring problem, this is definitely going to help you. All right, so I hope you enjoy that, and I'll see you in the next video.